My name is Hannah Kirshenson, and I'm a nursing student at Glacier Hills. I'm going to present a patient to you now. Patient is an 84-year-old married Caucasian female. She works as a food service worker for a school district and plans to retire in June. Patient was transferred to Glacier Hills Rehab Center after undergoing left knee replacement surgery at St. Joseph's Hospital on March 21, 2014. Patient's left knee began to bother her in June 2013, which made her tired and affected other parts of her body. Finally, in March of this year, the pain began to interfere with her ability to work and her quality of life, so she underwent knee replacement surgery. Vital signs. I was not able to take vital signs on the patient, but her pulse would be within normal range of 60 to 100 beats per minute. Her respirations would also be within normal range of 12 to 20 breaths per minute. The patient has a history of hypertension or high blood pressure, which is being controlled by numerous medications, but her blood pressure may be slightly above the normal readings of 120 systolic and 80 diastolic. The patient's temperature would also be within the normal range of 36 to 38 degrees Celsius taken orally. At this time, the patient does not feel pain in her left knee while resting, but feels pain when she walks. Pharmacological and non-pharmacological interventions to treat this pain include Tylenol, 650 milligrams by mouth every 6 hours. Health history. Patient has no history of childhood illnesses and is up to date on her immunizations. Patient has a history of hypertension or high blood pressure, but has no history of other chronic or serious illnesses, either physical or psychological. Patient has no known allergies. Hospitalizations and surgery. Patient has been hospitalized for back surgery in the past and has also had a hysterectomy and cholecystectomy. Patient has also undergone cataract operations on her eyes and basal cell removal operations on her face. Current medications. Patient is taking benazepril 40 milligrams by mouth daily for high blood pressure, Norvasc 10 milligrams by mouth daily for high blood pressure, and metoprolol 100 milligrams by mouth daily for high blood pressure. Patient is also taking aspirin 325 milligrams by mouth daily, calcium carbonate 500 milligrams by mouth daily as an antacid, potassium chloride 20 milligrams daily, and alprazolam 0.5 milligrams by mouth daily for anxiety. She is taking hydrochlorothiazide 25 milligrams by mouth daily as a diuretic, and enoxaparin 40 milligrams subcutaneously daily as a blood thinner to prevent clots. Functional assessment. Patient does not smoke and drinks very little. For exercise, she does housework and goes to work at her job. Patient sleeps an average of 8 hours a night and eats a balanced diet. Psychosocial data. Patient is married and has 3 children with her husband. She completed high school, is a Methodist, and visits her medical doctor on a regular basis. Patient feels a lot of stress because of personal and family reasons, but she states that she is able to cope with it. Family history. Patient's mother lived to age 95 and died of old age. She had high blood pressure. Patient's father died of a heart attack at age 60. Patient's grandmother had rheumatoid arthritis, and her father, brother, and mother also had arthritis. Patient's children are healthy. Review of systems. High priority system number 1, peripheral vascular. Because of the patient's recent surgery to replace her knee, it is important to assess her peripheral vascular function to ensure that her extremities are receiving adequate blood flow so as to detect and prevent blood clots. Because of the surgery on her left knee, the patient reports pain while walking. However, she denies any presence of pain in her right leg. The patient reports no hair loss or coolness on her legs. She has no history of blood clots and does not have varicose veins. Upon palpation of the patient's pulses, the grading of her pulses is as follows. Temporal, 2+ bilaterally. Carotid, 3+ bilaterally. Brachial, 1+ bilaterally. Radial, 2+ bilaterally. Femoral, not palpated. popliteal 2+ on the right side, 0 on the left side because of swelling of the knee, posterior tibial 2+ bilaterally, dorsalis pedis 2+ bilaterally. The patient's capillary refill was 1 to 2 seconds bilaterally on her fingers and toes. High priority system number 2, musculoskeletal. Because of the patient's left knee replacement surgery, it is important to assess her musculoskeletal function to determine if there are any limitations in her range of motion or strength. Assessing these aspects will determine if the patient has any problems that could interfere with her activities of daily living. Other than her left knee because of surgery, the patient does not have any swelling, redness, warmth, or deformities. The patient has pain in her left knee while walking and pain in her shoulders. The patient reports that this pain does not cause any limitations in her range of motion except in her left knee. This patient states that she is able to perform activities of daily living. She reports having some weakness in her legs but not in any other areas. Her grandmother had rheumatoid arthritis, and her mother, father, and brother also have a history of arthritis. Upon inspection, the patient's muscle mass and bone structure is normal and equal on both sides. However, because of the patient's surgery, we were not able to assess her posture, gait, or test for scoliosis. The patient has normal range of motion bilaterally in her TMJ joint, neck, shoulders, elbows, wrists, fingers, right knee, and right ankle. Because of the patient's surgery, we were unable to assess her hips, left knee, left ankle, and spine for range of motion. The patient reports pain in her left knee and shoulders. No erythema, warmth, pain, or crepitus was noted in any of her joints. After testing the patient's muscle strength, it was determined that she has a muscle strength grade of 5 bilaterally in her deltoids, biceps, triceps, wrists, right hip, right hamstring, right quadriceps, and right ankle. The patient has a muscle strength grade of 3 in her fingers. We were unable to assess her muscle strength on her left leg because of her recent surgery. Pertinent system number 1, cardiovascular. The patient has a history of hypertension and a history of heart attack in her family, as this was her father's cause of death at age 60. According to an article published by the American Heart Association, age and the presence of high blood pressure greatly increase the patient's risk for developing cardiovascular disease. Because of the patient's advanced age, high blood pressure, and history of heart attack, it is important to assess her cardiovascular function. Pertinent system number 2, integumentary. The patient previously underwent operations to remove basal cell carcinoma from her face. According to an article published by the Journal of Rheumatology, age, Caucasian race, and a history of non-melanoma skin cancer increased the patient's risk of developing non-melanoma skin cancer. Because of my patient's advanced age, Caucasian race, and history of basal cell carcinoma, it is important to assess her integumentary system to record any changes in her skin. Doing this assessment will aid in the treatment of any present growths and allow for the early discovery of possibly cancerous lesions.